Is Dr. Dick Walker. I'm here in Spokane, Washington, and we have a wonderful guest on our Zoom call this morning. The Kasier family has expressed some interest in learning from someone who knows specifically about how ASEA has helped his family actually with Lyme disease. I do want to just state that of course, ASEA is a nutritional supplement that does some wonderful things for our body in terms of helping it to deal with crazy problems like Lyme, but it is not something that is meant to cure, heal, or treat. It is meant to give the body an enhanced ability to take care of that on its own. I first met Dr. Richard Michael at the convention and heard his story and thought, it's amazing. It's great to have another physician on board with this. I've been involved for about 6 years. Dr. Michael is relatively new, but he's already now on the medical advisory board for ASEA, and I'm going to let him kind of introduce himself because he can probably do a better job of that than I can. So, Dr. Michael, just go ahead, and then we'll open up for some questions at the end. I may have a question or two for you as well. So thank you for being on this morning.
Sure. Well, I think it's my pleasure to be on the call. I'll give you just a quick background. I've been a very traditionally trained doc. I've been in practice 35 years in the same location in eastern North Carolina in a town called Rocky Mount. It's about as flat as a table is. That's a misnomer, but at any rate, we have a practice here that employs over 60 people. So we're a busy family practice. I was trained undergrad at UNC Chapel Hill, changed one shade of blue for another, went to Duke, got my MD there, and went up to Virginia, did my residency in family medicine. And we've been here ever since. I don't deliver babies anymore, did 50, and that was plenty for me. So at any rate, have been working at just a traditional family medical practice. And so you might wonder, well, how on earth did I intersect with ASEA, which has nothing to do with being a pharmaceutical agent? Well, the topic that was indicated for today's talk is how I intersected. And it was a personal intersection. It wasn't through a textbook. Literally, my second daughter, who now has their 9th kid, they adopted 3. She's had her 6th biologic. But they lived in Virginia in an area that was endemic, has become endemic with Lyme disease. And several of our kids, my grandchildren, had become infected by tick-borne illness. And they were having various degrees of difficulties. I had seen them personally. I don't treat my own grandchildren, but I'm certainly involved as a granddad and happen to be a doc. And I saw several of them have very big difficulties. And this was long after the acute phase. Now, this is where traditional medicine will basically draw a line, and they'll say, after the acute phase, there's really not an ongoing chronic illness. And they just don't pretty much ascribe to that. My grandkids were having problems. It really came to a head, and I tried to get them some traditional experts in the Research Triangle area. I found a guy who had written many textbooks on Lyme disease, was an expert in traditional approaches, and he basically didn't have anything to offer them. And they were continuing to have multiple symptoms, different ones, different types of symptoms. It came to a head about 2 years ago, around Christmas time, actually. They were over for just holiday, and 2 days later, I got a call. I was at my practice where I am right now. I was getting ready to see patients at 7:30 in the morning. My daughter calls me, tells me about the symptoms that the second oldest kid, at the time he was 13, was having. And I said, Anna, I know where the nearest medical emergency room is from where you live. Go there immediately. Take him immediately. Don't wait for them to try to find your place out in the country. Go now. He went there. He was transferred to Duke. He spent 5 weeks in Duke. He left with no diagnosis. And honestly, it's because they refused to consider that Lyme has ongoing issues and can have ongoing issues with people. I liken this a little bit to how far we've come with a disease called hepatitis C. You know, there were years ago, and Dr. Walker can recall this, that we didn't even have a test. There was no laboratory test for hepatitis C. You were called non-A, non-B. We knew you had something, but we didn't have a test for it. We didn't have any treatments for it. That's all changed. And I suspect that sometime in the future, that traditional medicine may come around on this. But there we are. I'm taking care of my grandson in the hospital. He died a couple of times. I would have to walk him to the bathroom. He couldn't talk. He couldn't swallow. He had some major difficulties. He left Duke to a pediatric rehab hospital. While he's in the pediatric rehab hospital, he made some recoveries. He could start to walk a little bit. He started to eat, and he could say some words. But he still had major challenges. And so my daughter and her husband, they take him home. And they're really having to make adjustments in their lives. You can imagine with somebody who's medically and physically challenged, that was what they were facing. And they had been using all sorts of supplements, devices for the kids, trying to find something that would work with their symptomatology. And now they're facing this. Bear in mind, my son-in-law, the daddy, he's a school teacher. They don't make a whole lot of money. They're running out of money. They're running out of emotional money in the sense of their kids are hurting, various symptoms, and there they are as parents. And there's nothing that medical knowledge can give them. They're trying all sorts of supplements. Nothing's working. So they're really at a desperate time in their lives. How the intersections with ASEA occur is amazing to me. To make it short, a high school friend, her mother was using ASEA. This lady was given about a 18-month death sentence because of a bunch of cells, bad cells that had matriculated to her brain. And she's alive today. If she walked in this room, you couldn't tell her from anybody. In fact, she just had recent scans showing no activity in her brain in terms of bad things. She takes 1 bottle of ASEA a day. But her daughter knew my daughter in high school, saw the plight of my grandkids on social media, said to Anna, my mom's using this stuff. I don't know if it can help your kids, but you should give it a try. They couldn't afford it. That girl had it drop shipped free to my daughter and her husband, to their house. And I'll get a little emotional here. But someone cared enough about her to make sure that happened. Shortly, within about a month of giving the kids the gel and the oral ASEA, dramatic changes happened. Dramatic. And I'll tell you something. That young man that would face plant in the hospital at Duke. He's running 5K races now. He doesn't have headaches. The other boys that were affected by the Lyme, they're not having the symptomatology anymore. It's absolutely amazing. My daughter, if she was on this call, she would say to you, she has her family back. She has her family back. And it's just been, that was the eye opener for me. And quite honestly, how could I avoid that? I couldn't ignore it. Even though I'm traditionally trained, this was a supplement. Honestly, I had never heard of redox biochemistry. I knew 2 sentences worth from my medical school. But this got my attention big time. I went out, bought 3 or 4 medical textbooks, pored over them, trying to figure out what is redox biochemistry all about. Well, after spending that 3 to 4 months, basically kind of going back to medical school a little bit, I came to the realization this is real. And somehow they found out a way to stabilize these molecules outside the body. This is amazing. And I thought, this is the track of how it's helping my grandkids. And since that time, it's been an amazing journey for me, utilizing it in countless cases, either as a consultant on the case or firsthand with my patients. And just amazing, amazing stories, because these molecules go all over the body. They go to all the organ systems, and it's a blessing. So again, to wrap up, Lyme, very personal to me. I can read about it in a textbook. I can gather how the redox can work there, but I had firsthand experience with it. So I'd be happy to answer any questions, or if you want me to elaborate on anything.
Dr. Michael, could you discuss, I know people always ask us how much ASEA does it take? What sort of dose have you seen work with your family members? And I'm sure you've talked to a lot of people about this since you've gotten involved.
Yeah, I always try to get the context of the person using it, trying to figure out what exactly is going on. I try to do a more global assessment rather than focus on the one big item. Everybody has that 1 or 2 big items, but usually we have issues all over. But typically, I know the kids are most of them are 6 to 8 ounces a day on a regular basis, and their ages are generally around 8 up through 16.
Okay. Yeah, I know dosing can be relative. What I've seen is that a lot of people who think that ASEA isn't working for them just aren't taking enough or taking it regularly enough, and I'm sure you've come to that same conclusion. I'm going to open up the mic for Bob Crazier, and there's one other family member on here, and because I'm sure they may have some questions, and I want to give them first go, because if they hadn't asked for this call, we wouldn't be having it probably. So Bob, do you have any questions you'd like to ask Dr. Michael?
Well, I don't know whether you need to have any of my family history or not, or whether just ask the questions. But essentially, my wife came down with symptoms. I think she was about 57, tingling in the extremities, and we tried to figure out what was going on. And turned out that she had lesions on the brain similar to MS, and that was what was causing a lot of the problems. They didn't definitively diagnose her with MS, but certainly she had the symptoms. And the short of the story is she thought it was a gluten allergy. Some doctor told her that. She got off gluten for 2 years. And then she had a friend who had Lyme and said, you should be tested for Lyme. And so she went to a Dr. Ross in Seattle, and he decided, because of the symptoms and because there were companion organisms with it, that it was Lyme. And so he put her on an antibiotic regimen that lasted another 2 years. And supposedly that has taken care of a lot of the problems, but the antibiotics were detrimental in and of themselves. And she still has brain fog and fatigue and anxiety and depression and things like that. But essentially, we believe that she was infected with Lyme, and then she passed that organism on to a number of her children in vitro. Joseph, who is online, has had similar symptoms, and I think he was diagnosed with Lyme, as much as you can diagnose it. And he had a shorter treatment with the antibiotics. Number two went through the antibiotics with Dr. Ross, and they seem to do fairly well for him. Number 5 has had continuous problems for a number of years with brain fog, fatigue, lack of energy, depression, hurting joints, hurting muscles, and things like that. And he probably, next to his mother, has the most severe case of whatever it is. So we've been searching for a number of years for some sort of answer. We've been taking the ASEA, I think only about 4 ounces a day, so perhaps we need to jack that dosage up, particularly for my wife and son and some of the other family members who are experiencing symptoms. So that's kind of my story. Dr. Michael has given us some pretty good indications, and Dr. Walker and certainly the Armstrongs, that maybe there's hope out there for something. Now, my number 5 son, who has had the most severe symptoms, has been trying the Rife machine, and I think is making some progress there, but he has terrible Herxheimer's afterwards. He's able to endure longer sessions now, but that's kind of where we're at on this. We're willing to give it a try and give us a go, so give us some guidance in what we ought to be doing here.
Okay. Yeah, I think hearing your story, I mean, a couple things stand out. I think that certainly you want to try to dose this on the higher side. I'd make sure that folks that are definitely affected in an ongoing way are taking at least 8 ounces a day. Okay, so these are adults. I would assume of various ages. So even in the best of circumstances, we decrease our production natively of these redox molecules by decade. It's just a matter of fact. And so you're going to have to climb a higher hill regardless of what external forces have been in play here. So, I would say 8 is probably a minimum, maybe 10 to 12. And don't overlook the gel. For people that are having challenges musculoskeletal-wise, do not overlook the gel. Now, you have to remember how you take it properly and use it properly. You have to shake it. I shake it every single time it's being used. And remember, you can apply it 3 times over 5 minutes. That's only one application. You can continue to reapply. And then make sure that you're taking the oral ASEA in the proper manner. You don't want to denature the molecules before they have a chance to get going. So you want to make sure you're doing all the basic things correctly. But I think the big thing that jumped out is perhaps use the gel more than maybe it's being used, and at the same time bump up the oral usage.
So how should we use the gel? Where do we apply it? How often? How much?
Yeah, you want to, after you've shaken it properly, you want to apply an amount that you can just paint the region. I call it painting the region. So let's say it was a knee that was the problem. You would paint the knee on the front and the back side, and then you let it air dry. And that process takes under a minute, and then you can reapply it. So you can do that 3 times over 5 minutes. And very often with utilizing the gel, a person can see pretty fast response rates to know that something there is working. But you can reapply this multiple times throughout the day and the evening. So that's so anywhere where there's difficulty being encountered by the person, that's where I tell them to put it.
So pain and stiffness and that sort of thing, generally, I've found it works well for that.
Yeah.
Now, you also mentioned that it was important to take the oral stuff properly. Review with us what properly is. Can it be mixed with anything at all? Can it be mixed with water to dilute it, or does that risk tying up the molecule and making it ineffective? My reasoning was that it wouldn't hurt to put it with water, makes it a little more palatable, and it's been suggested that we make sure we're drinking adequate water. Is that a poor thing to do? I mean, it goes in the system and gets diluted fairly quickly. So review the basic principles with taking it.
Sure. I take nothing with it. I take it straight. I actually savor it. It's kind of like a wine connoisseur. You swish
I thought it was
it.
more like pool water.
Well, some people, and I certainly found this myself early on, you can smell the taste. Now, what I just said, smell the taste. Because when you're putting it up to your mouth, you're actually smelling the chlorine kind of smell, and it almost sends a signal that you're going to taste something as well. That actually goes away with repeated use. Now, somebody that's really challenged with that in the beginning, it's just very difficult for them to get it down. I would use the pouches. Use the pouches, because you're not going to get the smell from the pouch, and you just put that up to your mouth. You won't reflux back into the pouch. It's designed not to reflux back in. Now, here's an incorrect way to take it. Putting it in a metal cup of any kind. That will denature the molecules. Chugging it out of the bottle. That's no good, because your saliva and bacteria will get back into the bottle, and then that'll ruin the application. So you pour out only what you're going to use. You put it in your mouth. I swish it around. I might walk around and just do a few things, hold it in my mouth for 10, 15 seconds, because it's going to be absorbed on the inner aspects of your cheeks inside. And it's especially good, I mean, think about it. If you have any kind of dental challenges, gum challenges, hey, why not put the molecules right there? They're going to enter the system. As you swallow it, a good portion of the molecules have already been absorbed. So if you do it that way, so I would not mix it with water or any other substances at all. I mean, they don't give this stuff away, so why take a chance?
How frequently during the day, Dr. Michael?
Yeah, very, very good point. Thank you. I'd say for people that are having major challenges, if you can space it out and space it out throughout the day, it's probably going to be a better thing for you. When we're giving traditional medicines, we always look for that 1-a-day dosing schedule, because we realize how hard it is for people to dose multiple doses during a day. And I mean, I would look at your realities of your life, and if you only take 3 ounces in the morning, you're supposed to take 10 ounces a day, and you forget the other times, it's probably better to take all 10 ounces in the morning. But in a perfect world where you're diligent and can be disciplined, it's better to spread those out throughout the day.
Great, thank you. Are there any other questions specifically about Lyme that Dr. Michael can answer for you? Some of these other more general applications we can cover for you, but certainly I think the take home that I try to get across all the time is you've got to give this time to work. I guess that would be another question. How long did it take for your grandkids to really see a specific benefit from this?
Yeah. With different ones having different symptoms, but some of them started certainly within the first month of taking it, and others were in month 2. And I think that's again a great point to bring out. Just in general, the response rate is very, very few. Like 15% of patients will notice a big change in the first week, but that jumps up to about 50%. Now, this is not Lyme, this is just all comers. 50% in a month, 75% by 2 months, and by 3 months, basically 90% of people will find some major challenges dealt with. So I think the story there is, even with as an amazing product as this is, it may take time. It may take time because of the stresses on our systems and the age of the patient. All of those things play a role.
So, Dr. Michael, how does the molecule work? And that it, I don't believe, kills the Lyme. It must enhance the body's immune system to where it can combat it, and just what is the function of the redox molecule?
Yeah. Well, we know that in general, certainly we have, again, we're entering a field of medicine where it's very difficult to say what's going on chronically. Trying to isolate organisms from body fluids. But in my estimation, I think what will end up being shown at some point in the future is that the body is encountering results of an infection that are triggering the immune system to do some awful things to itself. There's tremendous inflammation going on. One of the boys would have recurrent major arthritis in one of his joints. And yet when they did all the testing, they couldn't find out any reasons. He didn't fit any of the nomenclatures for rheumatologic disease. So he was kind of idiopathic. But, we have a 6-year-old kid who is running like crazy one day, doesn't injure himself. And literally the next day he can't hardly walk. And I saw his joint, and it was inflamed and swollen. So there's an inflammatory response going on for sure. There can be co-infections. I think you mentioned that. One of the things that happens in the immune system, if you look on the bottle, that's probably a good place to look. Look on the bottle and see what the gene study purported to find, and that's that it enhances the immune system in our bodies. So exactly what is going on, boy, that'd be a great study. I wish we had billions of dollars to put into that, because honestly, there's a world of people that are hurting, and quite honestly, I mean, there's just there's a lot of dead ends for a lot of folks. And what I have seen, and this is just not my family now. I was involved with another kind of consultation, if you will, a lady in Oklahoma who wasn't sure she wanted to do this. I was asked to speak to her. We talked at length. Devastating issues from Lyme. And just to put it in perspective, one of the things that has happened is she's had such an amazing response using the ASEA. She remarked to her husband, walked in one day, and this was after just using it for a month. She had high heels on. She said, "Look, I'm in high heels." She couldn't wear anything but flats because of how it was devastating her musculoskeletal system in her from her ankles and down below. So again, it's an amazing product that has, you don't have to worry about side effect profiles. You don't have to worry about drug-drug interactions. As Dr. Walker knows, every time we write a prescription, our computers are going through that process. Efficacy, benefit, side effect profiles, all sorts of things. And with the ASEA, it's just a breath of fresh air, and it's giving hope to people who literally have lost hope.
Great. Well, thank you, Dr. Michael. We're at the half hour here. Bob, did you have any more specific questions about?
No, really. I guess to sum it up is keep the faith, keep going. It's going to take a couple of months anyway, perhaps, and that we need to increase the dosage. And it looks to me like that those who have the most severe symptoms probably ought to be up around the 8 to 12 ounces per day. Better if they could take it several times throughout the day, but the important thing is to get that much in, and even up to a full bottle a day, that it's not going to do any harm and may reap some benefits. So that may be why we're not seeing an awful lot yet, is perhaps we need to increase the dosage and be a little more patient.
Absolutely.
Is there any way to know when you're absolutely over the Lyme's? Because it tends to recur. I have never been traditionally diagnosed, but I've been diagnosed by non-traditional methods, and the symptoms vary so much, and there's so many different ways it can affect you. I don't know when you really know that it's a done deal, or is it ever a done deal?
You know, Janita, that's a good question. And with a problem like Lyme, because many times we're dealing more with the aftermaths of the infection that can go on for years. And so the best answer to that is when you're feeling better and the problems that you've been dealing with have resolved to a large extent, then your body has been able to repair and quit fighting itself and quit causing damage. And so it's really more symptoms. There isn't any simple lab test or anything we can do to determine when your body is fully recovered. It's just a question of, if it was brain fog, is that resolved? If it was joint inflammations and pain, are those gone away? And if so, then you're good. In terms of the ASEA, I've been on ASEA for 6 years, and I plan on being on it for the rest of my life, because I don't want to go back to issues that I had before. I want my cells to stay young and healthy and have the best chance of surviving and keeping me active and going. And I think Dr. Michael would certainly agree with that. So it's just a question of taking it frequently enough. Don't mix it with anything. Don't take it right on top of a meal. It works. You get the best efficacy if your stomach's relatively empty. But I think that pretty much wraps it up, Dr. Michael, unless you had any last words of wisdom here.
Well, I wish Bob, you and your family the very best. Be consistent, be diligent, and I think all the take-home points, you seem to have gathered those in quite well. You're in our thoughts and prayers, and I know that this can do amazing things that certainly can benefit your family, and so we'll be pulling for you.
Thank you, Dr.
Thank you
Michael.
very, very much, both of you, all of you.
Yeah, thank you. Thank you again, and thanks for everybody who's listening in this morning. And hopefully you've got some great information here. And if you have any questions, you could certainly give me a call. You know how to get a hold of me. So take care. Have a great day, everybody. And we'll see you next time.
Thank you, Dr. Michael, and thank you, Bob, for sharing your
Thank
family
you.
situation.
You bet.